Hey everyone, Nathan Hayes, IDOC Practice Finance Consultant with the question of the week from my living room, as it happens. Question this week is one that comes in fairly often, but how much should my associate produce? So associate doctors, owners usually assume that the associate is going to produce less than the owner. And fair enough, the evidence is in, and that's generally the case. But here's my feedback for owners, anyone managing associates, is the expectation should be that every doctor in the practice is producing at the same rate. And just remember, production is a function of, let's say, 2.5 things. First, you've got your number of patients seen. And for most young ODs coming out of school, if you're hiring a new grad, pacing is the first thing they're really gonna have to figure out. They were seeing 4 to 6 patients a day in clinic, spending 2 hours with the patient in optometry school, and now they gotta learn how to be a practicing optometrist and see 15, 16, 20, 25 patients a day, maybe more in certain settings. So that's one thing. How many patients you see is directly correlated to how much an OD will produce. Second thing is gonna be revenue per exam. And obviously critical reflection of prescribing habits. And the third piece is how well you code, billing coding, how well you receive from that. That's not completely in an associate or any doctor's control, but coding practices do matter, and they will affect the revenue that someone generates. And so really, if you think about it, this is an output of care. How much care an associate's giving to how many patients and how much care each patient is consuming. And as you manage an associate, I would always bring it back to discussions of patient care, because that's really what drives the revenues. How many patients you're caring for? Presumably your practice is good at caring for patients. We want to care for as many as possible. And then how much care do those patients consume, which is a revenue per exam thing. And again, I think that a well-managed practice, one that's going to be very sellable, desirable for buyers down the line, one that's going to work really well for owners, is one where basically every doctor is producing at the same rate. Certainly, once pacing's down, and it's important to clarify in your contract, associate doctor, you don't have the right to say no to a patient who needs to be seen. You're here to see patients. This is what we do. Obviously, if you want to take time off, you can, but we're going to see the patients in front of us. But once we've got that pacing piece down, the patient flow piece down, then the real thing we want to look at is prescribing habits. And my counsel is always to make this about having a consistent standard of care in the practice. So we want to have the same type of products being prescribed, the same suite of solutions being prescribed, the same multiple pairs per patient, the same complementary products and services for contact lens patients, so that if everyone's being consistent in that, one, every patient's going to receive the same care, which is important. Two, the revenue per exam should reflect that, especially with the codings in place. But really for owners too, and this is something I think that maybe we don't think about enough, is one of the, you can hire associates for a couple of reasons. One would be you've got more patients than you can see and you want to grow. Great. Oftentimes alongside that for most owners is, I need more time to run the business, to manage the practice, to work on growing it. And so I'm going to hire an associate to see patients to free up time for myself, which is right, and we encourage you to do that. Once you have that associate in place, just from a mindset standpoint, remember that if they're going to be generating, let's say, $300 per comprehensive exam on benchmarking terms versus your $500 per comprehensive exam, if there's a 40% drop-off in revenue when you're handing off patients, and it's not just because you've got all the presbyups and they've got a bunch of healthy 20-somethings, it's going to make it very hard for you to do that, and there's going to be an additional cost to you not seeing those patients. So it's important from just an ownership standpoint, from the freedom to hand off patients, you need that associate to produce at an appropriate rate. Now, what do you do if you're in this situation, you've got the associate in place and they're not prescribing the way you want, they're not seeing the pacing? I would have a monthly lunch of all the clinicians, pull a report with everyone's production for the month, yours, your associates, number of patients seen, revenue per comprehensive exam, and pull 5 charts each for every doctor, say, at random. And then just review everyone's results so they know it's possible. And then cross-review each other's charts and see. Let them ask you questions about how you're doing things, maybe on the coding front, maybe on the prescribing habit. Let you see their charts and how they're doing it, and give feedback that way. But again, frame it around a consistent standard of care for your practice, And the best run practices, the practices give their owners the maximum freedom to take time away and just hand off patients if they want to, focus their time on family or growing the business or what have you. Every doctor is going to produce at the same rate. So that's the question of the week. We're always here to help you if you have questions on improving your practice. And thanks so much.